Some religious beliefs and practices, cultural backgrounds, social and gender norms in Kenya increase the vulnerability to violence and risk of HIV acquisition and transmission while limiting the service uptake among the key population due to associated stigma and discrimination. Meeting targets and maintaining epidemic control EpiC has been implementing activities in Kenya geared towards breaking these barriers.
The EpiC program is a program that works with key population members and their partners to strengthen key population organizations, organizational capacity, as well as work with key population CSOs and key population competent organizations to address structural barriers to access to health services by key population members.
The USAID-funded FHI 360-led EpiC program implemented its activities in 7 counties, namely Nairobi, Nakuru, Kisumu, Busia, Kilifi, Mombasa, and Meru.
In these counties, we've had 10 sub-grantees at county level and 1 national level partner. Our work has been inclusive of working with bar owners and other stakeholders in the community. We've worked with religious leaders, we've worked with the media, we've worked very closely with the county teams, we've worked with other USAID partners to enable us to reach our target of ensuring key population programming continues, as it has been continuing well within the last 5 years.
Such ongoing technical support by programs that have already interacted with the different types of key population would be very supportive and would be welcomed in the future in terms of building the capacity of the different implementing partners in reaching the different types of typologies of key population.
Meet Shile Kasimu. Shile is a home-based sex worker in Nairobi. Having engaged in sex work for several years, she had fears that she could be HIV positive, but never gathered the courage to go for testing due to stigma and perceived poor reception in health facilities. The news hit her hard, she says, but the peer navigator walked with her with love, empathy, concern, and invited her to the clinic with assurance of her confidentiality.
Kati nilitokea positive, akanifuatilia with much love nini, akaniambia kuja kwa hosi yetu, tuna privacy, tuna nini, wewe usijali. Immediately hata hakuchelewa akanianzisha kwa ARVs dawa. Nikaanza kuona tu life ina change.
Leila is yet another beneficiary of the Bar Hostess Empowerment and Support Program BESP. She says she's found a home here where she can freely interact with her peers. She has since tested negative for HIV.
I was tested and I was happy to find that I'm negative, so I decided to be on PrEP. I've been on PrEP for quite some time and I feel more confident. I've also introduced so many sex workers to PrEP. In fact, PrEP ni mzuri sana.
Sylvia Akoth, the Bar Hostess Empowerment and Support Program Advocacy Officer, says through funding from FHI 360, they have been able to train 10 paralegals to aid in identifying and following up of violence cases filed by their clients, health sensitization programs on their human rights, and support for mental health wellness programs.
Through KPIF, BESP was able to get a mental health counselor who used to come here every Thursday of every week. Her work basically was to talk to sex workers who are experiencing or who are survivors of violence or who are currently experiencing violence in their line of duties. We also used to have support groups for survivors of violence, which she also conducted the support groups of survivors of violence.
BESP was also able to identify community stakeholders to continuously help in dealing with challenges faced by sex workers in this community.
This really helped us in addressing more so cases, because you will find a sex worker has been violated with a client. Maybe the client hasn't paid her and the client has beaten her. So through that, we were able to address amicably by the help of the paralegals.
At Jinsi Yangu, an organization working with intersex, transgender and gender non-conforming persons, says the organization has been engaged in various campaigns that have helped Jinsi Yangu to meaningfully participate in policy implementation forums around HIV programming.
Due to this, with support from a number of international policies when it comes to access to HIV services, as well as just the progressive nature of the government of Kenya, we were able to influence the formulation and development of the trans guidelines, which basically provide a roadmap framework of how to program and implement HIV programming for transgender persons in Kenya. It's something that is very progressive. So in 2019, through tremendous support from EpiC and FHI 360, we were able to initiate our HIV program at Jinsi Yangu, which was previously non-existent. And most of the services that our members, that is the trans community, and when I use the word trans, it's with a little asterisk up there that is inclusive of also the intersex and gender non-conforming persons. That is how it's written in policy.
Health Options for Young Men on HIV and AIDS and STI HOIMUS is yet another organization based in Nairobi offering health counseling services to key population members. Ray, who is an MSM, says he was drawn to HOIMUS because of its ability to offer online consultation services which guarantee an extent of anonymity and confidentiality for members seeking its services.
I was happy when I keyed in my data, and I most preferably liked the condom provision, consultations, HIV testing. They even asked if I was comfortable in taking PrEP, which for that time I was not comfortable discussing them. I was later convinced on the usefulness of PrEP, and they enrolled me actually.
He gained courage and physically went to HOIMUS for a face-to-face consultation.
He asked me several questions on prevention measures and how my partners I know their HIV status. So some of them, since I'm an MSM, some of my partners I don't know their status.
Beyonce is a transgender sex worker based in Kisumu County. Since the COVID restrictions began, Beyonce has been arrested several times due to her gender identity. Beyonce and her peers experience more violence compared to other key population members due to their gender identity and sexual orientation and non-acceptance by the society.
Kisumu hapa being a transgender sex worker is very quite difficult. Ni kama umebebea roho mkononi. Na so long as hiyo ndio kazi ambayo unataka ufanye, hautaogopa ati kwa sababu ati nini. No.
So EpiC has been instrumental in ensuring that the systems of the organization are well structured. We address GBV cases amicably. We also enhance prevention of GBV cases among our target population. We also bring on board key stakeholders that will help us to ensure that there is free access of services among our target population through support and of course through just intervening in our implementation progress or implementation processes to ensure that there is nothing that affects our implementation period.
FHI 360 has been very good at enabling us to deepen the engagements between the communities we serve and law enforcement. We've had a lot of community members trained as champions in the community and who have very good relationships with law enforcement. So we have had situations where now we have almost a sustainable system in the community where community members who have challenges, particularly violence, then directly link with police at the police stations, and some of the solutions that come about don't even involve us. So we think that has come because of the many trainings, the many opportunities to attempt very different ways, strategies that has been presented to us by FHI 360.
Initially, people thought that police or a police station is a no-go zone for such people. Normally, we see these people as part of the society because the society is not complete without such people.
Tangu to engage na mapolisi, watujue, watutambue. At least violence imekuwa imereduce kidogo. Imekuwa reduce, si kama kitambo. Hapo unaweza kushukuru sana.
She attributes this change to the sensitization activities by Keeping Alive Society's Hope Cash in Kisumu County.
Watu wa Cash wamejaribu kivyovyote, wameweka gender based desk kwa police station zile ambao tunawaka nao karibu. Juu nikienda kureport case, sieni kureport case as a sex worker, no. Naenda kureport case as a human being.
Frederick Abayo, a project officer at Keeping Alive Society's Hope, says through the Key Population Investment Fund, KPIF, EpiC has been able to strengthen the organization to provide community-focused HIV prevention, care and treatment services while addressing the existing structural barriers.
We used to do a clinical health service provision. We realized that violence is prone and violence is a major barrier to health-seeking services to the key populations that we target. We target a key population, and a key population person is someone who is at risk of getting or contracting HIV and AIDS due to nature of work they do, stigma that they face in the community.
CASH has sensitized law enforcement agencies and healthcare workers to support the work they do.
I can say I enjoy working with them. I've met most of them. We work one-on-one. If they have cases, they refer to me. And I also have some cases that I've taken to court. Others are pending before court.
Kuna violence yenye at our end hatuwezi address. Rape, murder, hiyo lazima iende tu photo protocol, twende polisi. Kama mshukiwa atapatikana ashikwe. Hiyo tuwezi fanya dialogue. Kuna zile zenye sex workers wakigombana huko wenyewe kwa wenyewe ama wamepigania clients. Unapata mmoja anakuja kuripoti hapa. Fulani tulikuwa na yeye amenifanyia hivi, sijafurahia. But cases mingi tumekuwa tukimalizia hapa kama smart ladies through ADR.
Police Constable Christabel Onyango, stationed in Kisumu, says the program has been beneficial in Kondele area, where she is based, and the collaborations between sex workers, CASH, Men Against AIDS Youth Group MEGO, and the police has helped reduce violence against key population members.
Because at Kondele here, we have a lot of sex workers. So they know CASH work one-on-one with police, and these gender desks have really helped because it is not only in Kisumu, in Kondele here, and many police stations within our county.
A toll-free number where sex workers can call in case of violence has been provided. In Mombasa, Munyi Abbas, working with Reach Out Center Trust RCT, says the center has been working to address barriers and increase uptake of health services for people who inject drugs.
Kama sijavuta huwa siwezi fanya shughuli yoyote, yani wala kazi yoyote. Unaona, yani inakuwa mgonjwa kwa ufupi. Kukimbia siwezi, kula siwezi, kuchota maji siwezi, yani siwezi fanya kitu chochote.
Now complementing what Reach Out has been doing, which basically is now targeting the people who inject drugs with a package of harm reduction services, which includes distribution of clean needles and syringes, reaching out to the key population in terms of now education, providing health education in terms of now understanding on safer practices, which also include the use of condom and now distribution and demonstration of condoms, and now engaging them in terms of now accessing clinical services.
Some of the activities carried out by Reach Out Center Trust are sensitization of key population members on their human rights and to identify and respond to violations, reaching out in collaboration with stakeholders, including sensitization of duty bearers. According to Jessica Omai, working for the Nairobi County Directorate of Health Services, collaboration between FHI 360 EpiC program and Nairobi Metropolitan Services has greatly complemented the county key population HIV programs.
When they came on board, I think that is the best thing that ever happened, because they were just coming to complement some of the services that we were offering, and some of the services that they were coming to complement included, we had an advocacy committee that was missing. And from there on, they were also able to support us in various aspects in the HIV program.
She notes that implementing partners have been empowered through the program. Other activities include creation of an enabling environment within Nairobi County for key population members to access services.
There was a very good enabling environment between FHI 360 and the county.
In addition, healthcare workers have been trained to better understand how to support key populations, thereby eliminating stigma and discrimination to improve uptake of health services for key populations.
Training of the healthcare workers within that geographical location also really helped, because as you realize, key population, especially to the healthcare workers, not everybody understands how to support the program, so we had a lot of stigma around it. And I believe in the 3 facilities that they were supporting, anybody can now walk in, irrespective of your gender, irrespective of what you do, and they're able to get services without discrimination.
The partnership has been excellent. In many of the undertakings, they engage the government. Whatever it is that they want to do, they always walk around side by side with the government. We worked very well with the county assembly to be able to support the key population organizations.
As we come to the end of the KPIF grant in Kenya, we want to sincerely thank the USAID and PEPFAR teams for giving us this opportunity to serve the key population community in Kenya. We are so happy that with the support of KPIF, building on the gains that linkages had started in the last 5 years, we're able to have sustainable growth, we're able to have sustainable steps that can be maintained with support from the counties where key population programming is continuing. And we are confident that moving forward, we are able to see these gains move on, and we're able to have community members gain even better access to health services. Shukrani.